Okay, let's go through these urinary questions. I'm going to give you the symptoms and how to ask the patient if they have the following. Let's start with urinary frequency. Now, the medical literature in Spanish will list it as frecuencia urinaria. Frecuencia urinaria, this is how you pronunciate it, frecuencia urinaria. Now, as you can see in blue, that's the way to ask it. So you can say, ¿tiene usted frecuencia urinaria? Or for short, you can just use tiene. That would be, ¿tiene frecuencia urinaria? And they should be able to understand you. Now, when the patient means that they have urinary frequency, they won't use the proper term. They'll use stuff like this, what you see in orange very soon here. Now, the patient usually says, orino mucho, I pee a lot. They may also say, orino a cada rato, or ratito, which means I urinate every short while, or every short little while. They also say stuff like, orino cada 5 minutos, which means I pee every 5 minutes. They also may say, orino mucho en las noches, which means I urinate a lot during the nights. Now, how to put this in a proper form for a question? Instead of O at the end of orino, you can replace it with an A and add a question tone to it. You can say, orina mucho, do you pee a lot? You can also say, orina a cada rato or ratito, again with the question tone. And patients will understand you. When I interpret the urinary frequency, I oftentimes ask, orina mucho? And they will either say yes or no. Of course, if they say yes, that means yes, positive for urinary frequency. You can also ask it like this, orina a menudo? Do you urinate frequently? And the last one, you can say, orina mucho en las noches, which means, do you pee a lot during the nights? And that's usually all the forms that I've seen it and how I present it to patients. Now, urinary urgency. The medical literature uses urgencia urinaria or necesidad urgente de orinar, which is Spanish for urgent necessity to pee. Again, patients don't usually say this, but if you want to ask it like that, ¿tiene usted necesidad urgente de orinar? Or for short, ¿tiene usted tiene necesidad urgente de orinar? Your option if you want to use it like that. Some patients may not understand you, just giving you a heads up. But if you want to use it, that's perfectly fine. It's proper. A lot of patients will understand you if you say what I'm writing right now. Tiene urgencia urinaria. Now, this is the pronunciation if you're struggling with it. Urgencia urinaria. Again, patients don't usually express themselves like this. Some do. But they usually say stuff like, when you see an orange here, they say stuff like, me dan muchas ganas de orinar. I have a lot of urges to pee. They may also say, no aguanto las ganas de orinar. I can't handle the urge to pee. When I interpret it, I usually ask it like that. Le dan muchas ganas de orinar. And this is how you ask the question in Spanish, in layman terms. So you would say, ¿le dan muchas ganas de orinar? Do you have a lot of urges to pee? That's the usual phraseology that they use for overreactive bladder or urinary urgency. ¿Le dan muchas ganas de orinar? Or you can just say the second one with the question tone. You don't even have to change anything. Let me erase this here. You can just say, no aguanta. Well, I guess that's the only change, the A at the end. No aguanta las ganas de orinar. And if they say no, that means positive for urinary urgency. If they say yes to the first question, le dan muchas ganas de orinar. If they say sí for that one, that means yes, positive for urinary urgency. Hope that helps. That's the best way to ask it, in my opinion. Now, blood in the urine, sangre en la orina, or orina con sangre, which is urine with blood. You can ask it using the blue formula that I've been giving you. Tiene usted, and then add the pink. Or just tiene and add the pink for short. Now, the types of urine: clear, pale yellow, yellow, amber, or red. This is the definition that your patient will normally use when describing it. Orino normal, I urinate normal. Orino transparente, I urinate transparent. They may also say orino amarillo, which is I pee yellow. Orino obscuro, I pee dark. Orino color naranja, I pee orange. Orino rojo, I pee red. Orino con sangre, I urinate with blood. Or orino sangre, I pee blood. Now, if you want to ask the question, you just ask a question tone and change the O to an A. So you can say orina normal, do you pee normal, orina transparente, orina amarillo, orina obscuro, etc. You pick it, just add the question tone and add the A instead of a no at the end, and that should present itself as a form in the form of a question. Very useful if you ask me. Now, this one, painful urination or burning with urination. A lot of professionals struggle with this one, but this is how you ask it. Now, the literature says dolor al orinar for painful urination or ardor al orinar. Now, you can use a short version and say, tiene dolor al orinar, or you can just say, tiene ardor al orinar, which is, do you have a burning sensation with you? Do you have burning when you pee? Now, foul-smelling urine. Again, the medical literature in Spanish will write it as orina con olor fétido, foul-smelling urine. Now, patients don't usually say that. They say stuff like, mi orina huele mal, my pee smells bad. Mi orina tiene mal olor, my urine has a bad smell. Mi orina apesta, my urine stinks. Or, mi orina está apestosa, which is my urine is stinky. Now, this is the best question if they have if you're wondering if they have foul-smelling urine. When I interpret it, I usually ask this form. Su orina huele mal. You know, you're not calling them stinky. You're not presenting it in a negative way. You're just very respectfully asking, su orina huele mal. Does your urine smell bad? And that's it for now. Let me know if it's helpful. Don't forget to subscribe to Instagram, TikTok, where I post daily